options. Okay, here I am. I'm recording. So everyone, again, good afternoon, welcome. My name is Lisa Dooley of Your Organized Life. I am the new SSWBN president. I'm so excited to join people for actually our second event of the quarter. We are really excited as a network to, again, to be able to bring this content forward. Back at our December quarterly meeting, we asked people, what would you like to see? What are some of the topics you would like us to cover? Really, bring to the forefront what kind of programming. And so we are really working hard to create the content that you're asking for, to bring that programming forward, to continue with the mission of the SSWBN, which is collaboration, contacts, connecting and building community. And this is how we do it, by continuing to move through opportunities like this. What I'd like to do is just kind of go through a quick introduction. I'm going to call on you because how I see you in my Brady Bunch screen, I think is probably easiest. So I'll start. Again, my name is Lisa Dooley. My company is Your Organized Life. I have been a professional organizer for over a decade now. And as I was thinking about this topic, the very important topic of caring for seniors, especially right now during COVID, I was thinking about a situation that I was having a conversation with an estate attorney. And he said to me, Lisa, I so feel your frustration when you're dealing with clients who haven't really taken the opportunity to get organized. He said, I have a client who is well into her 90s and is living in a care community that is in lockdown. He said, I need to get to her in order to, her family wants her to sign updated estate documentation. And we cannot get together. We do not have the ability to do that. He said, I am so frustrated for them. They are so frustrated. He said, so what I urge my clients and what I try to help my clients do is sort of get ahead of that. Like, no one wants to be in that situation, struggling and really feeling like they have really put themselves into a position. So that's what I help my clients do, which is to get into a position where they are living a less stressed and less overwhelmed life, sort of across the board. So that's a little bit about me. So I'm going to go left. Emily, I'm going to go to you at the last, Emily. So Shannon, good afternoon.
Wait, you said Emily and then Shannon.
Yeah, I'm going to skip Emily because she's going to be presenting. So sorry about that. Sorry, Shannon.
That's okay. So yeah, I'm Shannon Donovan. I own Small Biz Doctors. Mostly we do website and lead generation, digital marketing, all over the board for that. I also am a professor at Bridgewater State University, teach finance, entrepreneurship, and so if anybody needs help with any websites, lead generation, SEO, you can give me a call.
Awesome. Thank you, Shannon. And Shannon is also a newest board member. We're so excited to have her. Yay. Lauren Gregory, good afternoon. I keep on saying good morning, but good afternoon.
Hi, everybody. Lauren Gregory, MedMinder Pharmacy. We're a full comprehensive pharmacy located in Needham. But what makes us different is we have an automated device that will flash, then a half hour later it'll beep, then a half hour later it'll call the client, patient. Everything comes pre-synced. It's innovative. It's amazing. I've been working in this industry since '95. My background's PT. I've started and sold 2 private care home care agencies, and this is hands down the best medication management system I have ever seen. And it comes right to your door. Everything is shipped, it's synced. The pharmacists are not dealing with the public. We're close to the public, so they're just working for patients, and it's amazing. I want to figure out a way to do virtual tours because it's like the best kept secret in the area. So it's fairly new to the South Shore of Worcester area. It's flying off the shelves. It's my job to introduce it here, and again, it's free. Qualifying 5 prescriptions a month, and that includes inhalers, eye drops, creams. So, and then you get the device for free. So if you know anybody that needs help taking the right medication at the right time, then MedMinder's for you, definitely.
Awesome,
Nice
Lauren.
to be
Thank
here.
you.
I was a
Yay.
member of this group in like 2003.
Oh, well,
Um,
welcome back.
yeah, from 2003 to like 2010. Janet LaBerge was the president when I moved on and did something else. Yeah,
Yeah, we miss Janet as well. She's moved on as well, but
I
we're
know.
so glad that you're here. Such a needed thing, Lauren. So thank you for sharing that. I'm going to go left. Pam Cunningham, how are you?
Hello. I didn't enter any other information because I'm retired as of 12/31 from financial planning, financial advisor. But I'm also a former board member and have been a member of South Shore Women's Business Network since 2015 and served a couple of different roles in capacity on the board, including secretary. And I also worked, and my very first activity was working on the newsletter. So that's about it for me.
Well, congratulations, Pam. We all want to be Pam today. We're all want to be Pam. So thank you. Randy, welcome.
Thank you so much. Great to be here. And it's funny, I was a member back in the 90s when I was a stockbroker. That was a long, long time ago. Now I am working with a primary care company called Boston Senior Medicine. It's very unique because we have a niche. We only do house calls. And right now we're accepting new patients who have Medicare. So it sounds so fancy, like a nice concierge practice, but it's just Medicare. It's not expensive at all. I put my information in the chat bar.
Wonderful. Thank you. Thanks, Randy. That's exciting. Well, congratulations. That's awesome.
Thank you.
Gonna get out. Mary Ford, good afternoon.
Mute.
There
Good
you are.
everyone. It's amazing how diverse this group is in terms of background and businesses and occupations, whatever. But I'm a new member of the board. I'm taking over from Pam, so I'm very intimidated by the whole thing.
Don't be.
And hopefully I can succeed and follow in her footsteps. I'm a retired newspaper reporter, journalist, editor, but I've continued to use my skills by providing an editing service. And I'm also a writer. I hope I'll be a published author at the end of next month. So I'm excited about that. And I just bought Lisa's book on Amazon. So you've got another book sold there. And I just read the little prologue.
Well, thank you. I appreciate
You're
that,
welcome.
Mary. And we're so excited to have you. Mary, again, you know, I'm in Cohasset, and you know,
Yeah.
Mary was the voice, right? And so we
Yeah.
are so thrilled to have her not only as part of the organization, but as part of the board, because one of the things we're looking to do is to continue to send out really great content. And we're going to really rely heavily on Mary for that, because she's amazing at that. Donna, good morning. Good afternoon.
Hi, I'm Donna Emschweiler. I currently own my own Mary Kay business, which has been going on for 10 years. I am a registered nurse, and I've got a lot of other things in my bag of tricks that I've done over the years. And I agree with what Lisa said about planning ahead. It's never too early to think about things, so that when things have to fall into place, it's a lot easier on everyone.
Yeah, thank you, Donna. I know, Donna, we're so thrilled you're here today. And Donna is also the vice president of the board, and she really is she helps us keep our brand consistent. And I think, you know, we're going to talk about a lot of, you know, sort of situations and different content for small business owners, which a lot of us work for small businesses or small business owners. And Donna really helps us keep our brand consistent and keeps us in front of eyes. And that is so important, because our goal is always to, you know, to be a valuable resource to our members and to the folks out in the community. So thank you, Donna, for all that you do for us. Okay, Leanne, welcome.
Hi, everyone. Nice to see you. Happy New Year. So ironically, I reached out to Lisa the other day, and she reached back to me and told me about this meeting. So here I am. So good timing. I'm Leanne Welch. I am Director of Community Relations for Welch Senior Living. I am fourth generation Welch. We have been serving seniors in the South Shore communities for over 70 years. We have assisted living, independent living, and memory care in Weymouth, Hingham, Marshfield, and Duxbury. And we just opened up our fifth community. It's a memory care assisted living on our same campus as the Village at Duxbury. It's called Duxbury House. If anyone's interested in touring, I'd be more than happy to set up a time. It's beautiful. It's amazing, state of the art. We are taking admissions. We are open. All our communities are open, following all CDC guidelines and procedures, and private tours are available. So Leanne Welch, Welch Senior Living.
Thank you, Leanne. I'm just going to give a quick plug. A friend's mom recently passed, and she was at down in Duxbury at your community, and could not have spoken more highly of how responsive and kind and compassionate your folks are. So congratulations, because you're doing a fantastic job. So we've had, you're welcome. So we've had, Galena is joining us, but I'm going to go to Michelle, and then we're going to pop back to Galena. Hi, Michelle.
Hello there. Hi, everybody. Michelle Werdeman. I am also on the board. I am the new event coordinator and have been working with Lisa on the transition. So I'm excited. So I am also a certified financial planner. However, I retired from a major brokerage firm about 1.5 years ago, and I started a coaching business. So I'm a certified life, weight, and career coach, and I teach boot camp, and it is not the boot camp that you get at a gym. This is a boot camp for your mind. Our thoughts are so, important, and being able to be aware of what we're thinking in order to create any result really that you want in life, whether it's with a relationship, a financial goal, a business goal, whatever. It all starts with our thinking. So I do an online membership. It's month to month, and each month is a different topic. So January, we're focusing on really how to make shit happen and continue with it, because, people will do resolutions, and, sadly by, a week or two in, they're gone. So our focus in January is really becoming aware of the thoughts that we're having so that you can take action and continue to take action. So that's what I got for you today.
Michelle, thank you. And yeah, so Michelle is aptly taking over the role of event coordinator. And I think as you all, like I said, in the December breakfast, we all talked about some of the things that we were hoping to see in the programming. So if you want to host event, if you want to do a lunch and learn, or you'd like to, really take part, please do reach out to Michelle directly. All of her information is in the chat, and she can be reached directly there. And also, if you, if you have not put your contact information into the chat, please do so as well. So Galena, good morning or good afternoon. Keep thinking it's morning.
Good afternoon. Yes, let me just put the video on so that you can see me. Yes, good morning. I'm Galina Pikorovskaya. I'm a chartered financial consultant. So I can see that there is a number of financial advisors here. I'm one of them. Do some presentations online. All my business is obviously online, like everybody else's right now. Focus on retirement planning at this point and stage, because a lot of people are retiring. Baby boomers are retiring. So retirement planning is my focus right now. And again, I'm doing some presentation on retirement pitfalls, on Social Security insecurity, and other things. So if you want me to do a presentation for this group, I'd be happy to. So.
Okay, Galena, thank you. And it's nice to see you. We haven't seen you in a while. I hope all is well.
Know. Yeah, no,
Great.
all is well. Thank you. It's good to see you.
Excellent. Thank you. Okay, so I hate to, I'm trying to multitask, but there's a few people that are still trying to join. So I'm going to go to Stephanie. Stephanie, good morning. Stephanie, afternoon. I'm sorry. I still think it's the morning, people. I apologize. Stephanie, good afternoon.
Good afternoon. How is everybody today?
Good.
Okay. Well, I'm Stephanie with Mary Kay. I guess we're doing introductions.
Yes.
I've been at this business for 30 something years, and see, now it's so long I can't remember how long. Every day is a different day. I teach skincare. I teach color cosmetics. I also am team building. I'm looking for women who need an opportunity to be their own boss or who need a little extra money. You know, it's a great company. It's always forward moving, and we are the only cosmetic company that made money during this pandemic. So we're growing in leaps and bounds. Estee Lauder and a couple of others, they really went down as far as sales are concerned. So excuse my appearance. I had to go to the chiropractor this morning. So that's all about Mary Kay.
So Steph, thank you for sharing that. Steph, also our former treasurer on the board. So for those of you who don't know Stephanie and Donna and their businesses, this is much more than, this is not a sales job. This is a customer relations job. This is about how do I build my own small business? How do I manage it? And how do I respond to what the customer needs? And as what you heard Stephanie say, is we've heard all this past year, how responsive they've been and how they've really been able to turn their business, which used to be a very face-to-face business, to virtual. And I think there's a real lesson there for all of us, Steph. I think they really crushed it. So, so thank you. So last but hardly least, and I've got a couple people, people are still trying to log in here, but I'm going to turn it over to Emily Rogue. Emily, I'll give my 2-minute introduction. Emily, I could spend 20 minutes, but I'm going to give 2. So Emily also is a board member. She manages our membership piece, which is such a critical piece for us. We're so thrilled to have her as part of the board and to have her part of the network. Emily is going to tell you about Two Sisters and the work that they do. But again, today is really responding to a need that our members have said is we feel like the sandwich generation. You know, we are the ones that are sort of stuck in between raising our children or our young adult children and our parents. And there are so many things we don't know. That's what I always say is you don't know what you don't know. So we wanted to have this conversation, this very important conversation, to get to learn the resources that we need, to learn to ask the questions that we wouldn't even know to ask until you're in this situation, right? Until you're confronted with it, you don't even know what you should be asking. So we're so thrilled to have Emily here this morning. So as Emily starts, I'm going to, if you are not muted, to just mute yourself. And at the end, after Emily done, we'll be able to ask some questions and really pick her brain. So welcome, Emily. Thank you.
Thank you. So I'm just going to dive right in and share my screen with you. Can everybody see what I see?
Yes.
Excellent. Okay. Now let me put you guys over here. Okay. So I am Emily Rogue from Two Sisters Senior Living Advisors. I was supposed to be joined by Michelle, who is our CEO and fearless leader, but she had an emergency come up today and couldn't join us. So you guys are stuck with me. I think, you know, today's presentation is going to focus mostly on COVID and how it relates to senior care. And it'll become clear what we do. And a lot of you, I think, are already familiar with what we do. But at a glance, we help seniors and their families understand their senior living options, from staying home with home care to assisted living to nursing home care and everything in between. So as I mentioned, today's agenda, we are going to focus mostly on frequently asked questions and senior care options and how they relate to COVID-19. I don't need to tell you that the pandemic has affected everything over the last year. But unfortunately, you know, people who need care still need care, and that can't be avoided. So hopefully we can, or I can teach you some things today, put tools in your tool belt. So if and when the need arises for senior care, you're fully prepared and know what questions to ask. I'll also spend some time briefly overviewing the scope of senior care. And then we'll open it up to questions and answers in a discussion at the end. Sound good? Okay. So before I start in this slide, I have to say that this one slide is typically a 60-minute presentation. I'm going to do my best to condense it, especially knowing that, a bunch of you are in this space already and know everything on here. But if you do find that you want more information about the content on this slide that I didn't get into, please reach out to us. We can let you know the next time that we're offering a senior care options presentation, or we can answer any questions you may have on the topic. So again, just a brief overview of the scope of senior care and what we're looking at, and then we'll get into some specific concerns regarding COVID-19 and how it affects these options. Now, most people who call us, their goal is to stay home as long as possible. With often when somebody starts needing some care, they'll first look at home health care. Home health care can help with things such as, laundry, light housekeeping, medication management, meal preparation, as well as physical assistance with, toileting, showering, transferring. All of those things can be provided by home care. When somebody first starts exploring home care, I usually suggest that they first call Elder Services. Elder Services will let you know that based on your financial situation and your care needs, if you may qualify for care to come into the home. Often the feedback that I get from my clients is that the services provided through home care services provided through Elder Services are not enough. And it can be a little tricky scheduling somebody to come in consistently. So if the care that you need is beyond what you can get from Elder Services, it will be about $25 to $35 an hour on average out of pocket. And most of the time, these companies do have 2 to 3 hour minimums per shift to make it worth the caregiver's time to come by. So you can see how if you need someone to come in a couple days a week, it can be worth your time and finances, but otherwise it can add up pretty quick when you start needing somebody there around the clock 24/7. The other thing that I wanted to mention that I put as a bullet here is adult day health. Now, pre-COVID, people could go to adult day health during the day. There are typically centers of anywhere from 10 to 100 or 200 clients at a time. Monday through Friday, some even on the weekends, where they can get companionship, oversight activities, as well as some provide, hands-on nursing care as well. Since COVID, it's been virtually impossible for these adult day health centers to keep their residents safe. And a lot of them have not been operating just because, people going home and then going to the centers and then going home again, it just doesn't work out. So adult day health has not been an option for many people in the last year. So with that being said, if home is no longer an option, then that's typically the point where people will look at moving to a more supportive environment. And that includes independent living, assisted living, memory care assisted living, or nursing home care. Independent living is just like it sounds. Typically, people are motivated to move to independent living for the lifestyle and amenities when they don't want to or can't take care of their home any longer. So for example, they don't want to, deal with New England weather and shoveling and clearing snow, or just keep up with the maintenance of their house and be part of they want to be part of a greater community setting. So with independent living, most of the time you'll have, your own apartment with a full kitchen, housekeeping, sometimes even laundry is provided, maybe 1 or 2 meals a day, but otherwise it's like you're living in your own apartment. You're just part of this greater community and can take advantage of everything that has to offer. Independent living ranges widely in the cost. It can be, a monthly rent model, or it can be part of a larger CCRC, continuing care retirement community, where you have to put a large lump sum down in the beginning that's refunded to a certain percent to you or your estate when you move out. So each model is a little bit different. Now, when you're looking at assisted living, in assisted living, similar to independent living, you'll have your own apartment with your own furniture. It can be a shared apartment, a studio, a 1-bedroom, or even a 2-bedroom. And the day-to-day really centers around the activities and things going on in the community, but the care is there if and when you need it. Not every assisted living provides the same level of care. I describe it kind of like a pendulum. And on one side, you have assisted livings that really lean closer to independent living. And they're all about the lifestyle and amenities. And as you start needing care, you either have to pay to bring that in or move out and get that somewhere else. On the other end, there are assisted livings out there that honestly function just like nursing homes in the amount of physical assistance that they provide. So they're doing 2-person assists and Hoyer lifts for people who can't get out of bed on their own, and assistance eating and all of that. But most assisted livings are in between those two extremes. Now, what assisted living cannot do, because they're not licensed to, is provide skilled care. So if somebody starts needing injections for insulin or a daily IV or wound dressing or something that needs to be done by a nurse, then they either have to pay to have a nurse come and bring that in or move into a nursing home to get that level of care. Everybody with me so far?
Mhm.
Okay, great. Now, most assisted livings, or I should say some assisted livings, have both traditional assisted living and memory care assisted living under one roof. The difference between the two is that in memory care assisted living, somebody can get care related specifically for those with cognition issues or that could benefit from memory care. It is a secure environment, meaning there's a code to get in and out, in a secure area most of the time, to protect their residents who may have wandering tendencies or who may be exit seeking. Now, a lot of these memory care communities, honestly, are state of the art, including the Welsh community, including Leanne's. Really, I mean, they take into consideration wandering tendencies of the residents to make sure there are no dead ends. You know, the lighting levels are taken into consideration to prevent sundowning and agitation. And it really is a very supportive and safe and comforting environment for those who may need it. Now, when you're looking at cost of assisted living, there are a few subsidies provided in assisted living, but they're pretty few and far between and only for people of a very low income level. So for all other purposes, you can think of assisted living as entirely private pay. If you're looking for traditional assisted living, it can range depending on where you're looking and what your care needs are, from $4,000 to $5,000 a month on the lower end, all the way up to $10,000 plus. Memory care, because you're getting more, is on the higher end of that. So you're going to look anywhere from $7,000 to $10,000 a month on average. Now, nursing home care is a little bit different. Nursing home care is like, I describe it like a step down from the hospital. So it very much feels more like a clinical setting. You're not going to have your own apartment with your own furniture. You're probably going to be in a hospital bed in a double room with somebody else next to you in a hospital bed and a curtain in between you. Now, because they are like a step down for the hospital, they can do more than assisted living can because they're licensed differently, as I mentioned earlier. And the other difference is that nursing homes take insurance. So for long-term care, they do accept Mass Health, which is the same thing as Medicaid. Mass Health is just what we call it here in Massachusetts, and Medicaid is the federal term. Medicaid will pretty much pay for everything you need in a nursing home if you qualify. It will pay for the room and board, the doctor's visits, medication, medical equipment, transportation, really everything, but they will take your monthly income and let you keep $72.80 a month for personal needs, like a haircut or new clothes or a new TV or anything that you want to use it for. In order to qualify for Medicaid, there is a financial criteria and a medical criteria. On the financial side, they want to see that you have $2,000 or less in assets. So it's asset-based, not income-based. And they'll look back 5 years just to ensure that there's no significant gifting or transferring of property. On the medical side, you need to require assistance with 3 or more activities of daily living. The government wants to make sure you need to be in a nursing home before they pay for you to be in a nursing home. So that would include walking with an assistive device like a walker or a wheelchair, bathing, dressing, transferring, any of those things would count as an activity of daily living. So that's a very quick and condensed overview of senior care options and the scope of senior care. Before I move on to the bulk of our presentation today, which is speaking specifically about COVID-19 and how it affects these options, does anyone have any questions about what I just discussed thus far?
Emily, I do. It's Pam. You said that the difference between memory care and nursing home, one of the criteria for nursing home would be your financial qualification for Medicaid. What about Medicaid for memory care? Does that come into play at all?
That's a good question, and I'm glad you brought it up because that's not something that I discussed. So again, when you're looking at assisted living versus nursing home, the difference is that assisted living, whether it be traditional or memory care, tends to be entirely private pay. When you're looking at nursing home care, nursing home is either private pay at about $400 to $500 a day, or they do also accept Mass Health or Medicaid. Now, if somebody has memory care needs and doesn't have the money to pay privately for assisted living and is on Medicaid, nursing homes do have what they call Alzheimer's specialty units. So just to back up just a little bit, if you're looking at nursing home care based on finances or because somebody has high care needs and needs that skilled care and oversight, every nursing home has what they call a Wander Guard system. And that's just a device that they can put on the person or their walker where they get close to the exit doors. It'll lock and secure and have a staff member alert a staff member to come and redirect them back to their room or back to activities. If somebody is actively exit seeking, meaning, they say, I'm going out, I'm going to the store, or I'm going home, and no one's gonna stop me. In that situation, then they do need a secure setting or an Alzheimer's specialty unit. And that's what I described similar to assisted living, where they have the code to get in and out of the unit. An Alzheimer's specialty unit is different license through the Department of Public Health, and not every nursing home offers one. But in an Alzheimer's specialty unit in a nursing home, all of the staff are specially trained to care for those people with dementia, whether it be from like the housekeeping and food service to activities to nursing. They also have special activity protocol and programming that's different from the rest of the nursing home, especially late into the evening when there tends to be more sundowning and agitation. And then they're required to have a secure courtyard area. So their residents in the warmer days can go indoors and outdoors and still remain safe and secure. So if somebody does have a diagnosis of Alzheimer's or dementia, and they're looking for nursing home care, I typically suggest that they look at those facilities that do have an Alzheimer's specialty unit, because even if they don't need that secure environment now, should their needs increase in the future, they'll be able to stay right there and just, move their room over and won't have to uproot and move to a totally different, nursing home. Did that answer your question?
Thanks. Yes.
Perfect.
Emily, this is Alina. I have a question. How does private long-term care insurance play into all these options?
Good question. So if somebody's fortunate enough to have paid into a private long-term care insurance policy, every policy is a little bit different in what they provide. But generally speaking, they'll have different benefits for the different, areas of senior care. So they may have a home care benefit, they may have an assisted living benefit, and they may have a nursing home benefit. You want to check with your provider to see which they'll provide and how much each day. Some will provide a daily rate of, $300 a day. Some will provide whatever the cost is. But often what people will do is they will pay the assisted living or nursing home or home care company out of pocket. And then the long-term care insurance policy will reimburse them directly. So you'll still be considered private pay in the eyes of assisted living or nursing home. And then you'll get kind of reimbursed on the back end from the long-term care insurance policy. Does that make sense?
Yes,
Mhm.
yes, thank you so much. And actually, I want to comment that if anybody wants to purchase the long-term care insurance, which I believe that everyone should have, unless they would qualify for Medicaid, I can help with that.
Perfect. Yes, it's much needed. And oftentimes, people will come to us and it's like an urgent situation and too little, too late. So if you can get ahead of that, definitely recommend it.
Yeah, and Emily, if somebody comes to you and you need, so you can come to me as well. Yeah,
Absolutely. I appreciate that. Okay, I'm gonna move along. So as promised, we're gonna kind of switch gears a little bit from general senior care now to talk specifically about COVID-19. So as you can imagine, over the last year, people have been calling us with a lot of questions related to COVID-19 and how it affects their loved ones' care. So the most common question we probably get is it safer to keep somebody home versus moving them into a facility? And the answer to this question is that there is no answer to this question. Honestly, it depends on the specific person's needs and situation as to what will be the best outcome for them. So I think with home care, it's all about limiting exposure for people coming in. If somebody needs home care round the clock and can pay to have them come in and they want to do that over moving into a facility, you have to think that, these home care companies usually have shifts. So that may be 3 people a day coming into the home, plus, grocery delivery, medication delivery, all of these things. There are home care companies out there, however, that specialize in live-in care, which could greatly minimize the risk of multiple people coming in and out of the home and the exposure that brings. So, and you also want to, consult with your doctor if somebody has a compromised immune system. These are all things to keep in mind when you're weighing your options. Typically, we suggest that it is not safe to keep someone home, and it is time to look at making a move to a more supportive environment if they're no longer safe, if they are starting to wander out of the home, or if they are having frequent falls, or if they require assistance from 2 or more people. At that point, you should look at moving to a more supportive environment. The next question is, if I move my loved one into a facility, will I be able to see them? And this widely varies across the scope of senior care and across, different facilities. We are keeping up to date with which communities and facilities have what restrictions in place right now. But often I find that each community is doing things a little differently. And it actually may relate to the specific town's Board of Health and what their suggestions are, combined with the regulations and limitations set in place by the state. So Long story short, in assisted living and nursing home care, many communities are still allowing visitation. You may need to call them ahead and set up a time to, a specific time to come and visit in a common area with the proper PPE. There may be a staff member there to ensure that you keep your protective equipment on during the visit, or you may be able to meet your loved one right in their apartment. But typically you have to call ahead. They're not just allowing people to show up. The next question is, if my loved one gets COVID and needs care, can they still get into a facility? This is a tricky question because the answer is yes. There are nursing homes and hospitals and care facilities that are taking COVID positive patients, but you will most likely need to look a little further out geographically, because many of them are not, but they are out there. What are the most important questions to ask of a care provider? So that's actually what I'm going to get to in the remainder of our presentation. We're going to look at each of the areas of senior living and questions that you should ask before signing on with a care provider related to COVID-19. So outside of that last question, does anyone have any other questions to add to this? Anything else they were wondering about COVID-19? Okay. So moving on, and we'll go through this part pretty quickly because some of it is redundant. But with home health care, if somebody starts needing home health care, again, as I mentioned earlier, the most important thing is to minimize the amount of risk coming into the home. And if you're looking at different home health cares and trying to find one that's right for you, the questions you should ask should include their COVID-19 protocol. So what are the company's testing requirements, not only for their clients, but for their staff? It's not so much an issue now, but it definitely was during the spring. But does the company have adequate PPE? And what is their PPE protocol? Are they coming into the home in a full gown and mask and face shield and all of it? Or do they come in just with a mask? Does it depend on, the client's specific condition and diagnosis? These are all good things to know ahead of time. And then, are they taking COVID positive patients? Even if you yourself are not COVID positive, it's a good thing to know if the company is accepting COVID positive patients, so what their procedure is surrounding that. For example, do the staff who see those COVID positive patients only see COVID positive, or are they going to other people's homes? I would like to think that it's the first of those two options, but again, these are questions to ask for your own peace of mind. And then what is the company's procedure for staffing and covering callouts? We've been finding that many of these home care companies are having trouble keeping up with staffing, just because if somebody gets sick or symptomatic, then they need to come off of the schedule and be quarantined for 14 days. And any of their clients that become symptomatic, any of the staff members that were put in touch with them have to be taken off the schedule in quarantine for a specific period of time. So you want to make sure that with that, they have a solid staffing pool, enough people that they can pull from, where if they do need to quarantine some of their staff members, you're not left without coverage. Make sense? Everyone with me so far? Okay. Quickly moving along. So independent living, it's a little different than assisted living because these residents tend to be more independent and self-sufficient and are more easily quarantined if the community does need to quarantine their residents. They can, keep isolated in their own apartments without much of a disruption. However, the appeal of moving into independent living is about the community and the lifestyle and amenities. So you want to make sure that you know ahead of time if your loved one is making a move to independent living, you can expect if they do need to quarantine. So you want to ask, what's the move-in procedure? Do they need to be quarantined for the first 14 days? Can they have somebody come and help them move in with their furniture? How many people can come in? How often, how soon after they move in can they have visitors? All of those things. But, you know, most importantly, ask how their ancillary services or community programming has been impacted. So is housekeeping still able to come into the rooms? Are they still having communal activities and communal dining? Or have those programs been curtailed? Those are all good things to ask. And even if they are going on now, you want to know in the event if there's an outbreak or if something comes up, what that will look like if they do need to curtail those programs. And then what is the protocol for the residents moving around the community? Do they need to wear PPE at all times when they're in the hallways and out of their apartment? You know, and then with the vaccine, are their residents prioritized for the vaccine, and when can you expect to receive it? I've heard of a few assisted living communities not only offering it to their residents, but to their residents' spouses who will come in and visit so that they can continue to come in and visit and have that vaccine. Okay, I'm going to move on to assisted living. Any questions so far? Okay, so assisted living is similar to independent living, where many of the residents have their own apartments and can be quarantined in their apartments if needed. The difference is that typically in assisted living, those residents do have care needs. So there will be staff members still needing to come in and out of their rooms, you know, on a day-to-day basis. So questions to ask with assisted living. Many assisted livings are offering limited touring. So some of them are still doing, you know, everything is normal. In-person touring, you can come at predetermined time. They'll walk you around some of the common areas into a model apartment. Others are just doing virtual tours, and that could be via FaceTime or like a pre-made marketing video where it'll take you through. So, you know, everyone's doing something a little bit different in regard to the touring process, but you still want to make sure you're doing your due diligence and you're getting a sense for these communities. So just ask what their touring protocol looks like. Again, do they have proper PPE? What is the move-in procedure like? Do their residents need to be quarantined for 14 days or only until there's a second negative COVID test? What does that quarantine in their rooms look like? Are they still going to get meals brought to them? Are they still going to have activities and staff members coming to check on them? And then again, about the dining and activities. If they are having that now, the communal dining and activities, what will it look like if things need to change and they need to quarantine their residents again? And then again, questions about the vaccine, when you can expect it, and how will that impact their operations? Once everybody has received their vaccine, do they still need to wear their PPE? Are they still going to limit, you know, visitors and put restrictions on that? Those are all questions to ask, so you know all of that ahead of time. Okay, I'm going kind of quick because we're tight on time. But memory care is next on my list. This is such a challenge with memory care, because how can you tell somebody that has cognitive impairment and often, you know, an unrealistic sense of reality, that they need to stay in their room for 14 days in you know, right in their same four walls and can't leave, and expect them not to be agitated or upset about that. So memory care is a little bit of a challenge when it comes to quarantining new admissions or quarantining their residents. And some communities are requiring that for the first 14 days or until there's a second negative test, for them to have someone with them 24/7, just to ensure that, you know, they're able to be quarantined and not have to move, and they have that level of oversight. Others are, doing a really great job about having one-on-one activities and somebody doing, frequent safety checks to make sure they have everything they need. So it really depends on the specific memory care community as to what their move-in protocol looks like and their quarantine protocol. But you should definitely ask some of those questions ahead of time so you know what to expect when you're looking into memory care. Okay. And now finally onto nursing homes. So nursing homes are probably the most compromised population when looking at the scope that we've gone through so far. Often the people in nursing homes have more medically going on, they're more medically complex and require more care. And for that reason, the staff are going in and out of their rooms more frequently. And in addition to that, they're often shared rooms. So they're not able to kind of quarantine in their own apartment because there's often 2 and sometimes even 3 or 4 people in a room at a time. So for that reason, nursing homes have more restrictions, I would say, in place when it comes to COVID-19 than some of the other areas that we discussed so far. New admissions coming in do need to be quarantined for 14 days in a private room. And from there, they can get their therapy right in their room. They can get their meals. They can get one-on-one activities. And they need to do that, like I said, for the first 14 days. Visitation is restricted in nursing homes. But often, if you sign up for a predetermined time, you can get in to see them once a week, sometimes more, sometimes less, depending on what it looks like. But you want to ask all these questions up front, what you can expect for the admissions procedure, what that admission quarantine will look like. Can they still get all of the same therapies? Will they be able to go out to their appointments, their doctor's appointments, and then come back? Or will they need to be quarantined again if they do that? Again, what's the visitation procedure look like? And then what's the vaccine protocol going to look like? And what does that rollout timeline look like? Okay. Also with nursing home care, I think I just plugged this in here because I think it's really important for everyone to know. And that is the Medicare.gov Nursing Home Compare website. This is a website that will show you all of the nursing homes in your area based on, where you live within a certain mile radius and what their star rating is. It gets into, staffing ratios and how they compare to the Massachusetts average, inspection scores, and quality measures. It's not an end all be all. You kind of have to understand the data and what you're looking at and put context to it, but it is a good place to start. It's important because also on this website is information and reporting on COVID-19 in nursing homes. The data is just raw data. And again, it can be hard to sort through if you don't know what you're looking at. But you can see every nursing home in Massachusetts, actually across the country, and what they've reported for COVID cases up till now, and staff COVID cases and resident COVID cases. I also included the link to MEMA, the Massachusetts Emergency Management Agency, which also has some of that information. So if you find your loved one in need of rehab or long-term care in a nursing home, these can be good resources to see and a good place to start when looking at your nursing home options. Okay, moving along, last slide. So I also put together a slide for other resources. These resources are not specific to COVID-19, but they are specific to senior care. And all of them can speak to COVID-19 and how it has affected them in their operations. So of course, the Massachusetts Executive Office of Elder Affairs is the governing body that oversees assisted livings. The Department of Public Health is the governing body that oversees nursing homes. Same with the Center for Medicare and Medicaid, that's at the federal level. And then of course, you know, on the local level, aging service access points, the Frail Elder Waiver Program, which is a form of Medicaid to keep somebody at home as long as possible. The SHINE program, if anybody needs to explore their mass health eligibility or their insurance programs, SHINE is a free service through Massachusetts where they'll set you up with somebody who can help you do that. And then the Council on Aging, your local Council on Aging can connect you with different resources as well. And of course, you know, the VA. So you can find all of those programs and more on our website at twosisters-sla.com. And that's all I have. I tried to go as quickly as possible because there was so much to cover. I hope I didn't overwhelm anyone or rush too fast. But I figure now we can open it up to questions or comments, or if anybody wants to add to anything that I said, please feel free and do so now.
So Emily, thank you. That was amazing. I think in what I do as a professional organizer, I've worked with a number of clients, senior clients, as they've tried to make these decisions. And again, I would just say to everyone, ask the questions now, because what tends to happen is we sort of keep kicking that can down the road, and we don't take steps to address it, because aging and dying in our society is a very, very difficult subject. And those of you who are in the industry know that very well. And so I think the most important thing is ask the questions, because if someone you love, a senior you love, is not safe in their home for a whole host of reasons, that's really your starting point. And there are, as Emily said, all these gradations of care that are available. So you want to start with, obviously you want to start with, you know, what they need right now, but always be thinking about keeping them safe, because safety is a huge issue. It's a fall issue, it's a wellness issue, it's an isolation issue, and mental health in our country is at a staggering place for a whole host of reasons, but COVID certainly, and the isolation that comes with that. So thank you, Emily, that was amazing. So I'll open it up. Are there any other questions? Anybody want to, or comment or question for Emily?
Emily, that was great. Thank you so much. I learned a lot, and I thought I knew a lot, but I really didn't. It's wonderful.
And that's only skimming the surface.
Yeah, it's great. My husband and I are probably facing something with his mother in the near future. And I've been through it with my own father. So it's really important planning.
And everybody who calls us says like they don't know what they're supposed to know until you're thrown into the middle of it during, you know, an urgent situation or when something happens, which is why, you know, companies like ours exist to make the process a little easier.
I would say another thing about using an outside resource like Emily's is, I had a client, senior client, whose children just could not agree what was right for this client. They could not agree. They each had, you know, you put 5 people in a room, 5 people with different opinions on what their parent needed. And they needed to go to that outside trusted resource to give them a different perspective. And I know, Emily, you all do your own evaluation of the client, yes, of the senior, and you try to assess independently what level of care they might need, because again, you ask 5 children, 5 siblings, and they're each going to tell you something different. I've seen it happen. So that's why we use trusted professionals. That's why we use financial advisors and wellness advocates and senior advocates, because sometimes when we're in it, we are so emotional, we can't get to that rational part of our brain. And that's what we want to get to, because in the end, it's about keeping them safe. So that's huge. And thank you for what you do. I've seen them in action, and what they do is amazing. So anybody else, any questions? And again, please, if you have not put your contact information in the chat, please do so. So anybody else want to share or ask a question of Emily? Okay, well, she's amazing. So she answered all your questions. So there we go. Thank you. Thank you, Emily, for doing that. So again, so next steps for us today is I am going to go ahead. I'm going to save the chat. I'm going to follow up with all of you on this. I'm also going to upload this content because it was a lot of information. So you can go back, review it. Emily, that information is also available on your website.
Yep, absolutely. The information's available on our website,
Okay.
twosisters-sla.com.
Okay.
Or you could just shoot me an email or contact me if you have
Fantastic.
any questions.
All of Emily's contact information is in the chat as well. So, but this content will be on YouTube. So send it to your, send it to someone you think might need to hear this in a way that that's really laid out in a really rational way. Because what happens is we tend to jump from, squirrel, we tend to not go at it in a focused and meaningful way. So thank you for that. So we're going to upload that to YouTube. So check that out. Also, keep watching our social media. If you have not liked our Facebook page, which Donna does a fantastic job keeping updated for us, please do continue to follow us. Excuse me, so you'll see the kind of content that we're sharing. The next event is another one which we've gotten a lot of positive feedback on. On February 9th, we are doing a tax planning event, another lunch and learn, very similar to this. Helen Chang, who's a CPA, is going to talk about tax planning. And that is another subject where you could spend days, but she's going to give us all a very good overview. So that's coming up. And then we have a focus chat later in the month. We are again continuing, and then in March we're going to do business after hours, because that's something that folks have been asking us for, is to do some things in the evening. So we're going to continue to sort of mix it up a little bit. So please reach out to us. You can always reach us at info@sswbn.org, or any of us in any of the board members who were present today. Our contact information is in there. And I thank you all. I thank you all for joining us. I thank you for being part of the very, very important parts of this conversation. For any of us who have already been through this, you don't know what you don't know until you know. And it's as Emily said, when you are thrown into it, literally, it's like going from the frying pan into the fire. And in COVID, add that dimension. So thank you again, Emily. Thank you all for joining us. And I hope you all have a wonderful rest of the day. Sun is shining, people. So thank you all for joining us.
Thank you, Lisa.
All right.
Thank you,
We'll
Lisa. Thank you, Emily.
see everybody soon. Thank you all.
All right. Take care, everyone.
Bye.
Bye-bye.
Bye.
Lisa, don't forget to stop recording.